Myself, Dr. Nayana HK. I've completed my MBBS, MD in General Medicine and Fellowship in Diabetes. Today, I'm here to talk about the topic diet and gastric ulcers. As all of you know, gastritis is a very common problem today. So everybody in our clinical practice, the majority of the cases would be gastritis. But today my discussion would be on how the gastric ulcer and diet is related to each other. So first, let me tell a few lines about gastric ulcer. So as you know, there is a break in the mucosal lining of the stomach up to the small intestine. So that is known as gastric ulcer. There are various types of gastric ulcers. The two most important causes of gastric ulcers in today's lifestyle is one is alcohol, the other one is spicy food items, and also the bacteria uh, like the Helicobacter pylori, which is supposed to protect. The quantity is increased or iatrogenic or drug induced. So the use of aspirin, as we have seen in most of the cardiac patients, because they use it in a very long term, can predispose the patient to gastric ulcers. As I already said, spicy food items, it might be in form of masala item or green chilies, and fried items can predispose a patient to gastric ulcers. And also alcohol, if the intake is more than the recommended dose, it will definitely predispose a patient to gastric ulcers. And also smoking and any sort of stress, all can predispose a patient to the gastric ulcers. So how the patient present to us is, generally they come with the typical symptom of gastritis, epigastric burning sensation or pain abdomen, nausea, vomiting, heartburn. So these are all the common clinical features how the patient present to us in the OPDs. But if the symptoms becomes chronic, then definitely we have to take care and investigate and evaluate the patient for gastric ulcers. So next, coming to the food habits, any form of excess coffee, tea, soda, carbonated drinks, alcohol, and spicy food items can predispose the patient. And also any food items which is rich in vitamin C, like citrus fruits, orange, lemon, etc. Is actually vitamin C is known to protect us against gastric ulcer. But if the quantity is in excess, then it can predispose the patient to a gastric ulcer as well. So it is better to avoid vitamin C when you are in the acute stage of gastritis, meaning when you're experiencing heartburn, vomiting, belching, regurgitation, those symptoms. During those times, it's better to avoid the vitamin C containing food items, and later you can always start consuming once your symptoms are come down. Mainly, what are the foods which we have to concentrate on to avoid gastric ulcer is a good fiber-rich diet. So as you all know, the fiber-rich diet gives us the sensation of fullness. So mainly it's fruits like apple, or you can have vegetables like carrot, which is very good and rich in vitamin A, and especially now oats, barley. So all this broccoli, spinach, these are some of the food items which are rich in fiber. And of course, any sort of fermented foods like curds is very good for people with gastritis, which is going to provide protection also against the gastric ulcers. And of course, berries. Now, any like a cranberry, blueberry, strawberries, all these are very good because they are a good source of antioxidants, which will protect the stomach lining against the gastric ulcer. Last but not the least, you should have plenty of water. So, at least 5 to 6 liters of water is a very good fighter against the gastric ulcer. And also buttermilk, which is most of the people miss. So at least when you're hungry, have something instead of leaving the stomach empty. So basically plenty of water, then buttermilk, and fermented foods like curd. Again, it will be included in any form. Either you can have a curd rice or in the form of buttermilk, whichever form you like. So all this is a good source in protecting us against the gastritis, which when becomes chronic, like chronic gastritis, may result in gastric ulcers. So, and also other ways like reducing the stress, limiting the intake of alcohol, and also try and avoid smoking, and a good lifestyle and physical activity, all put together will result in a healthy lifestyle and prevention of gastritis, which indirectly prevents gastric ulcers.